News Talk 760 WJR is proud to present Women Who Lead. Profiling great women impacting the Great Lakes with WJR's Ann Thomas.
Is there a fix to the problem that you favor based on all your experience in this business?
Well, I believe in universal access very strongly. I think that we have to create the model for this country, which probably will include the insurance companies in some role. They're not going to go away, and they have a lot of clout. And it should include, the government in terms of providing a sort of level playing field around certain issues. For example, healthcare information, which we know is part of the solution long term, better access to a personal health record, using that more effectively if we seek care in different locations. But to do that, we've got to have some standards that the government sets to ensure that that information is very private and carefully managed so that it does not get in the wrong hands and we don't have privacy concerns for ourselves.
Right. Now, you're going to be part of a panel for Inforum on May the 9th. That day, as part of that panel, what will be some of the issues that will be discussed? Will this be the major focus?
I think we'll probably touch on a lot of issues, regarding healthcare today. I think my focus as, from the provider side, although I also understand the insurance side, is how we are going to deal with some of the value equation aspects. I also have the privilege of serving over the last few years as the co-chair of the Save Lives, Save Dollars initiative of the Greater Detroit Area Health Council. And that's a coalition model where employers and providers and health plans work together to try to deal with this value equation. How do we improve quality and reduce costs? So I know we're going to be spending time on that, but also on, the whole range of issues that we all have an opinion about in terms of how do we improve health care in this country, and how can everyone contribute to the solution.
What kind of a role should an employer take in helping to improve health care? How involved can they get in an employee's health without stepping over the line?
Well, I think certainly you want to create a positive work environment regarding health issues. And what I mean by that is, people work long hours. Right. So having access to fitness facilities, walking trails, programs that can help them improve their health, I think is extremely appropriate. And we've been piloting some of those with major employers in the community, whether it's a back program or it's looking at those employees that have diabetes and how they can better manage their care. So I think there's a major role. It's sort of how you look at the investment you make in health benefits each year, too. We've been looking at that. We're a big employer in this community, and we have a lot of health care costs. So, we wear all hats when we look at, being a provider, being an insurer, and also being an employer. And one of the things we've done is really look at our health benefit expenditure as an investment in our employees' health, which is a very different mindset. Then when you start looking at that, okay, how do we improve it? How do we make it better? How do we help our employees manage their health? And if you view your health as something you manage instead of just something that is,
right,
it's a different approach.
And you feel like you can control it.
Exactly. And we need to control it. Much like, if you look at your investments, you put a lot of time into that. Right. Your children, you invest a lot of time and money in making sure they develop. How about your own health? And I think that approach is something employers can really assist with, because we are at work a lot of our waking hours, and it's important that we create that kind of atmosphere.
Final question. As a major employer in the Metro Detroit area, as someone who lives in the area, works in the area, obviously cares a lot about the area, how are you viewing the area right now? Are you pessimistic, optimistic? What kind of final thoughts can you leave us with?
Well, I always tell people I moved to Detroit. I didn't grow up here, and I made a conscious decision to move here because I thought it was a great place to work and to live. And I believe in this community. It offers so much. And I've lived elsewhere. I've lived in New York. I've lived in Chicago. I've lived in Philadelphia. I've lived in Cleveland, Akron, and Columbus, Ohio. And I love this area. So I have to be optimistic about it. I think, again, sometimes we create our own problems, right, because our attitude is everything. And if we come across as negative about the place we live and work, what are others supposed to think? So this is a great town. It's beautiful places to live, a beautiful riverfront in Detroit, a lot of opportunity in the city. Yeah, we've got our problems, but almost every place does.
Sure.
And I think that, we have to make it happen. As major employers, we have to have a commitment. We have to be optimistic and positive about what we can do to change things. And that's the kind of organization, certainly, I want Henry Ford to be, and I think has been over the years. And that's our commitment for the future.
Special thanks today to Nancy Schlichting, the Chief Executive Officer of the Henry Ford Health System, for being my guest on Women Who Lead. I'm Ann Thomas. Join us next time on WJR.com.
You've been listening to Women Who Lead with Ann Thomas. For more interviews and podcasts, visit WJR.com.